An assisted cough involves the use of a stomach thrust to help build pressure to produce a cough. This video will demonstrate how to do the breath stacking and assisted cough technique while in a bed and with one person assisting. First, because the person doing the stomach thrust will be applying a forward and upward push to your torso, they'll want to decide if they're able to do that thrust with the needed amount of pressure while standing next to the bed, or if they'll need to be positioned on the bed. You and the person assisting will also want to decide how to do the breath stacking, which you'll do before the assisted cough. If you are able to squeeze the bag yourself, you can do the bagging while the person assisting positions themselves for the stomach thrust, or, as you'll see in this demonstration, the person assisting you can position themselves to do the stomach thrust with one hand while squeezing the bag with their other hand. Once you and your assistant have decided which position will work best for a good thrust, you're ready to start your breath stacking to prepare yourself for the assisted cough. Make sure to establish a signal with your assistant before starting to tell them when your lungs are full. It can be a head nod or a wave, whatever works best for you. To be ready to apply the stomach thrust after the breath stacking, the assistant will place the palm of the hand below your ribcage and above your belly button. When you're ready, take a large breath in through the mouthpiece. Hold that breath. The bag is now squeezed and you inhale with it, taking 2 to 5 successive breaths of bagged air. The assistant can count and say, "Breathe in" each time.
And breathe in.
The bag is squeezed until you cannot hold any more air. The bagger can tell this by feeling some resistance when squeezing the bag, or if you signal. Once the lungs are full, and just before removing the mouthpiece from your mouth, the stomach thrust is started. The assistant then pushes up with some solid force, but not enough to injure you.
All right, breath in, and big breath in, and breathe
You
in.
cough as the thrust is
Breathe
applied.
in.
The assistant
Breathe
can
in,
try saying "cough"
breathe
as a
in,
prompt.
And excellent. Got something there? Oh dear, you actually do. I do.
If the breath stacking and assisted cough is successful, a high flow of exhaled air will occur as the mouthpiece is removed. If mucus is loosened, you might hear a rattling sound or feel congested. Cough out as much mucus as you can and spit it out into a container or tissue. Repeat the whole process 3 to 5 times or until all the mucus is out. Rest in between cycles, and remember to clean the mouthpiece afterwards. After breath stacking and doing several assisted coughs, you should do 2 breath holds.
Breathe in again. And now just hold your breath, let it out.
The breath hold is done
1,
by giving you successive breaths using
3,
breath stacking,
4,
but instead of coughing at the
5,
end,
and a
you will
slow
hold your
release.
breath for as long as possible, from
That's
3
great.
to 5
Is that what you
seconds,
did? Or is
before
it-
exhaling.
That's good. Yeah. All right. So we end it like that, just so that you're not ending on that cough note, right?
So why would you want to do a stomach thrust to increase the force of a cough? A cough is your body's way of responding when something irritates your throat or airways. The irritant stimulates nerves, which then send a message to your brain. The brain then tells muscles in your chest and abdomen to push air out of your lungs to force out the irritant. However, a spinal cord injury at T12 and above affects the strength of your stomach and breathing muscles, and these muscles help you to take a big breath in, and you need the strength of these muscles to produce enough force for a good cough. And an assisted cough helps your stomach muscles produce this force.
Some things to keep in mind. Not everybody needs the combined breath stacking and assisted cough all the time. If you have a cold, that's when you would add an assisted cough. Consult with your healthcare team to come up with a plan for maintenance that makes sense for you.
So, when should you use the breath stacking and assisted cough techniques? To keep your lungs healthy, breath stacking should be done 2 to 4 times a day. Your respiratory therapist will set up a care plan that best suits your needs. In times of an infection, breath stacking and assisted cough may be done as often as every 10 minutes. It's best to do breath stacking before meals, but if you can't, wait at least 30 minutes after eating. This will help reduce the risk of nausea and possible vomiting. You can even do your own or assist with your breath stacking and assisted cough if you're able to squeeze the bag and apply your own thrust. Finally, the assisted cough. or stomach thrust may be used at any time to help move mucus. Your respiratory therapist can advise you if routine stomach thrusts should be used.
Do not do breath stacking. If you feel lightheaded, feel any chest discomfort, have an upset stomach, or are experiencing low blood pressure. If you think the breath stacking and assisted cough techniques are something you could benefit from, connect with your healthcare team to discuss lung volume testing and how to get the tools and assistance you'll need to get started.